give some details about the executive order? I know that the White House has just released a document. I haven't had a chance to review it.
Well, we can talk about that later. It's an executive order on immigration. We want Americans to have the jobs. We want Americans to have the health care. We want to take care of our citizens first. We have to. It's a very powerful order. It's for 60 days. At the end of 60 days, or maybe even during 60 days, I'll extend it or not, and I'll maybe change it. I might modify it. Yes?
Exemptions for immigrants who are already here, Mr. President?
Yeah, go ahead, please.
Immigrants who are already here in the country, or immigrants abroad who already effectively have a green card trying to get into the country, and healthcare workers.
We're talking about immigrants that are trying to get in, and we're talking about people, and also, by the way, people that are coming in illegally. Now, as you know, because you've seen the numbers, our border, our southern border, is very, very tight. It hasn't been this tight in years. It's being helped by 160 more than that miles of wall that are going up. I'm trying to get to 450 by the end of the year, 450 miles. And we'll have 530 miles early next year. And that's really great. It's fully funded. We have all the funds, and the Army Corps of Engineers is doing a fantastic job. Same people that did Javits Center, as you know. They're doing a fantastic job. So our southern border is very, very tight, for good reason, for very good reason. We're also being helped by 27,000 very good soldiers from Mexico, and I want to thank the President of Mexico. He's been terrific in many ways, including on what we're doing with COVID. And as you know, we have a very good trade arrangement with Mexico now, which we didn't have before. So I want to thank the President of Mexico, in particular for the 27,000 soldiers. They're doing a fantastic job.
For healthcare workers, sir? You want to talk about the exemptions for healthcare workers?
Yeah, we want to protect our healthcare workers, and that's one of the other reasons we're doing this. Yes, John?
Mr. President, I wanted to ask you about Rick Bright. He's the head of the federal agency in charge of getting a vaccine out to Americans once it's ready. He says he has been pushed out of his job because he raised questions about hydroxychloroquine and some of your directives on that. Was he pushed out of that job?
I never heard of him. You just mentioned a name. I never heard of him. When did this happen?
This happened today.
Well, I never heard of him. If the guy says he was pushed out of a job, maybe he was, maybe he wasn't. You'd have to hear the other side. I don't know who he is. Please.
And on the hydroxychloroquine...
Hold on 1 second, please.
Well, I just wanted to, you said by 4th of July you expect people will be on the National Mall and we'll be having a celebration like we did last year. Given what the doctors are just saying that, you know, coronavirus is still going to be out there, it might not be as bad as it is now, but it's still going to be circulating. Is that going to be safe to have that many people on the mall?
We're going to probably have 25% of what we had last year. Last year, as you know, was maxed out. I saw a magnificent picture of Dr. Martin Luther King. And I saw a magnificent picture of our event last year, and both of them were maxed out. It was beautiful to see, beautiful, very similar. This year, most likely, we'll be standing 6 feet apart. We'll have to do that in a very, very interesting way, and maybe we'll even do it greater. So we'll leave a little extra distance. But if we do that, we'd certainly do that. I don't see maybe the purpose if we can't do that. We have to have people, thousands. We had tens of thousands, most of you were there, tens of thousands of people last year. It was incredible. And it was, to an extent, an air show of all the different aircraft flying over. We even had Air Force One flying over. So ideally, it would be wonderful if we could actually have it as it was last year, and eventually we will have that. I think it's important to know, eventually we are going to have that. Your stadiums are going to be the way they've been for the last 100 years. No, I know, but your stadiums, as an example, sports, going to be the way they used to be. I mean, I told one of the owners, he said, "Do you think I should take out seats?" I said, "No, you shouldn't take out seats. We're going to have it the way it was. We're going to be back. This virus will eventually be gone. And if it should show up in the fall, we're going to put it out very fast. We have great people. We're going to put it out very fast because we've learned a lot. We've learned a lot about how to deal with this, and we'll put it out very fast." Yeah, please. Just nice and easy. Just please.
You talk a lot about testing capacity, and governors agree that that exists, but it's very different from testing implementation. And they are still begging for you to use your full authority to help them get reagents and other things. As you would like to say, what do you have to lose by helping them do that?
Well, I am doing
and becoming the king of testing?
And let me just say, we are the king of testing already. There's no country in the world that's done more. Not even
0.2% of the population has been tested. Is that good enough?
I just said there's no country in the world that's done more. And we have tests that have already come out that are going to be introduced very shortly that will do it more. My problem is this: it's very much of a media trap. Whether we did 2%, 5%, 50% or 100%, it'll never be enough, no matter what. Now, with the expertise and with what we did, because of our expertise and tremendous talent at manufacturing, what we did with the ventilators, that wasn't a trap because we got them done, shockingly to everybody, because of the incredible talent like Mike Pence saw yesterday in Wisconsin. But we have numerous of those sites all over the country doing the same thing. So that when the governors were complaining, some of the governors, I must say, and it was very much along party lines for the most part, but except for one, when the governors were complaining, we said, no, how many do you need? We need 50, we need 100. One governor asked for many, many, many thousands, and it turned out they didn't need that, and that's good. We got them, and nobody that needed a ventilator, you know this, and we went through this with the governors, that needed a ventilator didn't get a ventilator. That was an incredible achievement. With testing, it's a little different. It's much easier than ventilators. It's like 2%. But, for instance, the swabs are coming in by the millions. They're coming in, literally coming in by the millions. Totally ordered. We wanted the highest quality. We could have gotten a much lesser quality. We didn't want to do that. We got the highest quality. But testing, it's like no matter how well you do, you can always say more. With the ventilators, they either have them or they don't. In fact, we went to one meeting. Who wants a ventilator? One governor said, we'd like 25. 25, you got them. Who else? Nobody spoke up. That was 4 weeks ago. So that was great. The problem with the testing is, and I said, if we test 350 million people, you'll say, no, we want them to have a second test or a third test or a fourth test. Not everybody believes as strongly as some people in testing. Some people want to do testing because they think it's impossible for us to fulfill that goal. That's easy compared to ventilators, as I've said. But we have a tremendous testing capability, better than anybody in the world right now. And every day it's growing, and it's growing very substantially. These doctors are very talented people. They've seen testing all their lives. They've never seen anything like we've been able to do. So we're going to give everybody what they want with the testing. But again, testing, and I've said it from the beginning, the actual test has to be administered locally. You can't do from Washington or faraway locations federal testing nearly as well as you can where you have a governor and he has mayors and they have representatives and they know the back of a Walmart. Put it in the parking lot in the back of a Walmart, or put it in a certain location in different states. They're doing it beautifully. It's working beautifully. The relationship I have with the governors, and Mike has, and we all have with the governors, I would say other than one or two, but even them, they don't complain. They're not complaining. So we're doing tremendous testing. And ultimately, we're doing more testing, I think, than probably any of the governors even want. Okay, please, Jennifer.
Back on the immigration EO, can you say, is it just for green cards, for green card holders? Or
Green cards were
is it also for
subject,
people seeking temporary work visas?
It's subject to change. We have some people coming in, for instance, helping the farmers. We want to have the farmers take care. They've been coming for years and years, and they're helping our farmers, and they've been coming in for years. We don't want to do, the border's been turned off a number of times over the years. And you know what happened? Our farmers all went out of business. They were out of business. They couldn't farm. We're taking care of our farmers. Nobody ever took care of farmers like I take care of farmers, including the $19 billion that we're dispersing to farmers because of some very good things that happened.
Subject to change because some of your advisors are saying there could be a problem with it, or subject to change
No,
because
just
you want
it
to
might be
extend?
modified. It could be modified next week, in 2 weeks. It could be modified in 2 months. No, we may modify it as we go along. But right now we have a very powerful immigration ban, but it could be modified, meaning made tougher or made less tough. We don't want to hurt our businesses, and we don't want to hurt our farmers. Very important.
Can I ask you about your conversation with Governor Kemp? What did he say to you when you said you strongly disagreed with him? And of course, for gym owners and tattoo parlor artists and barbers in Atlanta and Georgia generally, would you advise them to listen to you and not to their governor?
Look, I'd like them to listen to their governors, all of their governors. I have the right to do if I wanted to clamp it down, but I have respect for our governors. They know what they're doing. I think, and As you know, Brian Kemp, governor of Georgia, I worked very hard for his election. He beat their superstar. He beat the superstar of their party. I think you can say I helped a lot. Michelle Obama, Barack Obama, Oprah Winfrey, they all went in. They campaigned for him very, very hard. And he lost. He also was way down in a primary and ended up winning a primary after I came out and endorsed him. So a lot of good things, and there's a lot of good feeling between myself and Brian Kemp. I like him a lot. I happen to disagree with him only in time and timing. I disagree. When you have spas, beauty parlors, and I love these people. I know the people from spas and beauty parlors, tattoo parlors, bikers for Trump, a lot of tattoos. I love them. I love these people. And barbershops. These are great people. But you know what? Maybe you wait a little bit longer till you get into a phase 2. So do I agree with him? No. But I respect him, and I will let him make his decision. Would I do that? No. I'd keep him a little longer. I want to protect people's lives. But I'm going to let him make his decision. But I told him I totally disagree. Okay.
Thank you, Mr. President. The Vice President, in his remarks, was talking about the federal efforts that have been undertaken as it relates to nursing facilities. And as you both know, they've been just so incredibly hard hit, just tragic. Over 10,000 COVID-19 deaths so far. The industry says that they're struggling as it relates to testing. Can you commit to increasing testing at the nursing facilities
Yeah, well,
across
we're
our
doing that
country?
automatically. I mean, that's almost common sense, but we're doing that automatically. I mean, you look at the state of Washington. That was our first glimpse of it. They got hit so horribly in that nursing home. It seemed like everybody was from a particular nursing home. So we knew immediately that was going to be a problem, and we're doing that 100%. We're taking very special care of our nursing homes and our seniors, other than me. Other than me. Nobody wants to take care of me. But other than me, we're taking care of our seniors.
Another
Yeah,
area.
please, Mike, yeah.
Thank you, Mr. President.
No, it's just an enormously important question. And we want to thank the American people who have been putting off visits to their grandmothers and grandfathers and moms and dads. It's tough. I'm going to be in Indiana next week, and I'm not going to go see my mom. She lives in her own home, but people get it, that the risk of serious illness for a healthy American of the coronavirus is fairly low. You'll either have flu-like symptoms or no symptoms at all. But as we've said so many times at this podium, and the American people get it, a healthy American could inadvertently convey the coronavirus to a senior with an underlying health condition and have the kind of heartbreaking results that we've seen in nursing homes around the country. It's the reason why from early on the president took decisive action to raise the infectious disease standards at every nursing home in America. He deployed all 8,000 of our inspectors, the Center for Medicare and Medicaid Services, to dedicate all of their time to ensuring compliance with those new higher standards. We've spoken about nursing home issues with governors around the country, and frankly, there are governors around the country that have done remarkable work with nursing homes. You mentioned Governor Brian Kemp. He actually used the National Guard in Georgia. He deployed them to nursing homes to do cleaning and to disinfect areas of those nursing homes, and it's tremendous service. But to your point about testing, if you look carefully at the guidelines, or Open Up America again, you will see that in phase 1, the level of testing that we contemplate is first that we want to be able to test anyone who has the symptoms that may be coronavirus and be able to test them quickly. Secondly, we want to do the kind of contact tracing, and Dr. Redfield and his team are deploying CDC teams in every state in America to be able to find out everyone that that person has been in contact with and test them. But if you look right underneath that, what we're directing states to do is be prepared to deploy testing resources first and foremost to nursing homes and long-term care facilities so that we can monitor any potential outbreak of the coronavirus among the most vulnerable population. Thanks to the leadership of our Surgeon General, as the President announced today, we're also going to be deploying testing resources to vulnerable communities, to underserved communities. The CDC released new preliminary data on the impact, particularly on African American communities in this country, and it's the reason why part of our phase 1 recommendation is that we deploy testing resources into those communities that are described by the doctors as socially vulnerable. And even as we speak, we'll announce next week that we're already in the process of deploying testing. And so it's a good opportunity to remind every American to be especially careful around our seniors, to heed the guidance about avoiding visitations, to protect the health of those who are most vulnerable. But the American people can be assured that from phase 1 forward, all the way through phase 3 and reopening, we're going to be helping to guide the states to focus on the most vulnerable, beginning with our seniors with serious underlying health conditions.
Mr. Vice President.
Hi, thank you, Mr. President.
We'll go back.
Commercial labs say that they need to buy new diagnostic machines to be able to double their testing capacity. Your administration has said that there's enough testing capacity to double overnight. How do you kind of square that difference?
Very easy. They can get new machines if they want, but even if they didn't, we have tremendous testing capability. You take a look at what's happening in California and New York. Governor Cuomo told us very strongly, he said, wow, we have a lot of labs. You know, it's a research center of the world. They have tremendous. In California, too, long conversations. They have tremendous testing capability there, too. Now, if they want to increase it, they can increase it, but they have plenty right now. You saw the maps the other day where we put up the different sites in various states, and virtually all states are like that. How about you with the mask?
Yes, Mr. President, may I actually follow up on those maps from the other day? On Monday, a reporter for a local television station in Miami sent me a question asking if it was possible to get the information on those maps distributed to the media so that local TV stations and newspapers can check on that information. So if that could be done.
Do you want to do that? Do you want to say something?
Sorry. Thank you for talking about testing and testing capacity, because we have been talking about that for several weeks, because we could see, and we did a full inventory of every single state and every single laboratory. And I also appreciate you talking about the implementation piece of the testing capacity. And it's complicated. So we have a team calling every lab and working through the American Society of Microbiology, as I mentioned before, to really work with every lab director to see what the issues are in each laboratory. And I just want to thank Administrator Verma, who really worked on increasing the funding for this test and uniquely doubling the funding for the coronavirus nucleic acid test. From $50 to $100 to really address some of the issues about laboratory technicians, because sometimes we think these tests run themselves. They don't. They actually need people to help with the machines. So we were talking about purchasing more machines. We actually need to have additional laboratory technicians to really be able to work all of those machines. And so it's lab by lab, state by state, and that's the dialogue that's going on now to unlock the full potential of the United States. Maybe the testing would not be needed at this moment, and maybe it is, but we want it also totally available in the fall if it comes to an issue where we have to distinguish between flu and COVID-19. So we're building infrastructure and capacity not only for today, but for tomorrow, and really showing a new way to really deal with pandemics and bring testing to scale, because the country has never had to do this before. I mean, if you look at some of the other countries, they're struggling with some of the issues from PPE to testing. And so this is a universal issue, but we're working on it as a collective to really have a very innovative and integrated way to approach testing.
But without building new, they have tremendous capability.
And the maps are, I will ask the companies, because obviously it's proprietary where every single machine is. And, you know, if you have that machine and 5 others, maybe you don't want to know let that person know you have 5 others. It's kind of like Coke and Pepsi. So I think we're working very deliberately to really be able to share those maps. The governors, I can tell you that all of the state governors and the mayors have those maps, and the addresses and the type of machine for every single laboratory in their jurisdictions, so that they know.
The governors were not aware that those laboratories were available to them.
Are there supplies?
Before you leave, on the state of California is now partially broken with CDC restrictions on who would get guidance on who should get testing, because they want to test people without any symptoms at all in high-risk environments like a nursing home. Do you agree with this, Vice President Pence? Do you agree with this?
Well, not only do we agree with it, it was in our guidelines. That was fundamental to our guidelines, and I think we were the first group that said testing asymptomatics will be key. We've always said that we think that's a significant contribution to infections, and we went to the places where we thought it was most critical to find cases the earliest, and so that is where we have asked states in the guidelines to start with nursing home, indigenous peoples, and people in underserved areas in cities to really ensure that we're monitoring for any type, because we know the asymptomatic piece may be the tip of the iceberg, in fact, be the iceberg underneath the surface. And so if you're only seeing cases, maybe this. But in parallel, we're working with states and local governments to really define what that population is by doing, in collaboration with states, working with them together to really reinforce this antibody testing, but in a careful way where you do 2 antibody testing to increase your sensitivity and specificity into the 99+% range, because we think it's really important that you have a very high quality test, but a high quality test that you can really tell someone that they've had this before. And so we're waiting to have those 2 tests that we can do in series to really assure people. But that was in the guidelines from the very beginning, and we think it's fundamental both for right now and going through the fall, because that will be our early alert if any of the COVID virus reappears.
How much more testing are we
John,
going to
you
need?
didn't know that was in the guidelines?
The CDC
Well,
criteria
it's
says
currently
that
in the
testing
CDC guidelines. So you're saying
It's right in the guidelines.
Dr.
Surprised
Birch,
that-
while you're there, can I
Jerome,
just...
would you like to say something to that, please?
Thank you, Mr. President. And I just want to reiterate to everyone that the task force and the administration have a commitment to protecting vulnerable people. And that includes in the area of testing. We've had the opportunity to talk to many different groups, and we hear that testing is absolutely a concern. And we'll be giving you more details in the coming days, but I just want you to know that we're building on the public-private partnership that the President rolled out with pharmacy and retail companies like CVS, Walgreens, Rite Aid, Walmart, and Kroger to accelerate testing for more Americans in more communities across the nation. We're going to be increasing access to testing for undertested, underserved, and minority communities, and we're working closely with partners and states to establish sites in areas most in need of increased access to testing. We're using data. CDC provided data to locate sites in counties that are undertested and socially vulnerable, especially with high populations of Black, Hispanic, rural, and Native Americans. We're using the CDC's vulnerability index, as you heard about earlier, to select sites. This measures the resilience of communities when confronted by external stressors along 4 main themes: socioeconomic status, household composition, and disability, minority status, and housing type. Our goal is to have about 2/3 of these initial sites located in counties with moderate to high social vulnerability, and about 1/4 of these sites in counties with high social vulnerability. So again, I want communities that are vulnerable to understand that we are strategically and intentionally making sure we're deploying testing in those areas so that people can get identified if they have symptoms, can get identified if they are asymptomatic, and that we will be able to deploy resources approprially.
Thank you, Mr. President.
I have a quick follow-up for Dr.
And I have to
Birch.
say, our Surgeon General is doing a great job. Thank you. Great job. Really good. OAN in the back.
Mr. President, thank you. Can we talk about Iran? You put out a message this morning making a rather big announcement for our military when it comes to Iranian aggression. Are you going to change formally rules of engagement for our U.S. military so that they can engage?
We're covered 100%. We don't want their gunboats surrounding our boats and traveling around our boats and having a good time. We don't want them anywhere near our boats. And so you know the order I gave. I don't think I have to say it again, but I've given that order. Under the Obama administration, it was taking place all the time. Under my administration, I gave this order early on, and nothing happened. They were very nice. There was no problem. But then I noticed yesterday they did that in a much lighter form, but they did that again. I said, we're not going to stand for it. So if they do that, that's putting our ships at danger and our great crews and sailors in danger. I'm not going to let that happen. And we will. They'll shoot them out of the water.
The U.S. military does not have to change its rules of engagement in order to follow your...
No, that's in the rules of engagement. That's a threat when they get that close to our boat. And they have guns. They have very substantial weapons on those boats. But we'll shoot them out of the water. Okay? Please.
Thank you, President Trump. If possible, I'd like to ask a question to Dr. Fauci and then a very different one to you. To Dr. Fauci, today the CDC and the USDA said that the first pets in America had tested positive for the coronavirus. What does that mean, and what should the public know about that?
Pets?
Pets, 2 pets.
So that question was asked before, but I'll be happy to answer it again. Certainly, animals, pets, can get infected. Big cats in zoos have been reported to be infected with coronavirus. There's no evidence that the virus is transmitted from a pet to a human. Now, obviously, is that impossible? I mean, biologically, anything is possible, but there's no evidence whatsoever that we've seen from an epidemiological standpoint that pets can be transmitters within the household. So it's not surprising. I mean, when you have viruses that can infect multiple species, isolating it from an animal doesn't necessarily mean the animal is transmitting it.
What about the lion in the New York Zoo?
Yeah, well, that's the lion of the New York.
How did that happen?
It probably happened. I don't know, Mr. President, but I would imagine that one of the zookeepers probably had an asymptomatic infection, took care of the animal, gave him some food, touched him or whatever, and that's how we got it.
Thank you. And President Trump, my question for you, President Trump, my question for you is, earlier in these briefings, you talked a lot about giving Americans hope, and you wanted to focus on that. But now that the crisis seems to perhaps be lessening, I wanted to ask you about accountability. And of course, millions of Americans became familiar with you as the tough boss who fired people for doing a poor job. I want to ask you about 2 specific things. There's a report from Reuters today that the HHS secretary put a former dog breeder in charge of day-to-day coronavirus efforts to begin with, and also on Facebook. Reuters reported today that Alex Azar, the secretary of HHS, put in a former dog breeder, that was his most recently former job, in charge of day-to-day operations of the coronavirus.
That I don't know, but you just tell me something. And what's the second?
And the second one is on face masks. Taiwan has a bigger population than New York State. Early on, they had universal wearing of face masks.
No problem with face masks if the governors want to do that. We ordered, I don't know if you know, 500 million face masks. We have hundreds of millions right now. And if people want to wear them, it's up to the governors. If the governors want that, it's up to now. It's more appropriate in some states, obviously, than others. You have the big plains, and you have certain states where it's much less necessary. But no, that's up to the governors, and we have that very well covered. I think face masks. But
people are wearing masks.
We have hundreds of millions of face masks, and we have at least 500 million. That's a lot. We'll have them very shortly.
Lots of people are wearing face masks now that the federal government advised it. It was almost overnight. But less than a month ago, our Surgeon General said that, and I'm quoting, they're, quote, not effective in preventing the general public from catching coronavirus. Should there be accountability there, and also for the HHS secretary?
Well, I don't know. Would anybody like to speak about it? I think, just so you understand, if somebody wants to wear them, I'm all for it. Would somebody like to discuss that?
Go for it, boss.
I think the comments that we made when we came into face masks, and I think it's important when we came out with the CDC guidance about face masks, or what we called face coverings, was in recognition of the growing understanding of asymptomatic infection or pre-symptomatic infection, was the recognition that we could use a barrier. And the reason, and I have mine when I'm in public right here that I use, that this barrier, in case I was in fact infected, if I didn't know, is a barrier to prevent me to protect you in case I happen to be asymptomatically infected. There's very good data to show that the ability of viral particles to go through a barrier is substantially diminished. And that's why we recommended these face coverings. I think if you go back to when CDC came out with that recommendation, some people may think intuitively it's to protect them from getting infected. No, it was to protect you from potentially getting infected by me when I go out in public. Jerome, do you?
Sure.
I actually appreciate you asking that question because it's one that that we've had to clarify several times, and I understand why the American public has been confused over time. As Dr. Redfield mentioned, initially we said, based on CDC, World Health Organization, and most other major public health organizations, that the public needed to know that these masks were not effective or shown to be effective in preventing you, if you wear a mask, from catching coronavirus. Another important thing to remember is the context of those statements was a run on medical masks, on N95 masks, and our healthcare workers were at risk. What's changed? What's changed is we found out that unlike past viruses that are spread through the respiratory route, a significant proportion of coronavirus cases can be traced back to asymptomatic spread. So the task force deliberated this. We've always told you that we will look at the facts and we will give people recommendations based on the best available evidence at the time. And once we saw that asymptomatic spread, we said, well, masks still aren't effective, and from our point of view, at preventing you from catching coronavirus in a significant way. But we've always told people that they should wear masks if they know they have symptoms to prevent them from spreading to other people. Well, now that we know about 25 to 50% of people are spreading asymptomatically, we suggested people wear cloth facial coverings to prevent asymptomatic spread. You wear your mask to protect me. I wear my mask, and Dr. Redfield mentioned it. I've got my mask. I believe I have mine on me, Bob. I carry mine around with me, too. I wear my mask to protect you. We're 6 feet away, which is why I'm not wearing my mask to protect you now, and we also all have been tested. So that's why I'm not wearing mine now.
Yeah, but I'm right next to you.
Well, I'll put mine on if you want me to, sir. But again, important to know that if you're going to wear a mask, it's not a substitute for social distancing. Still, social distancing is the number one thing you can do. Number two, it's important to know that you should practice good hand hygiene and not touch your face, because you still could touch a surface and bring disease to your face. And number three, this is the most important, well, it's just as important, please save the medical mask, the N95s, for the healthcare workers, because the cloth facial coverings are effective, as far as we know right now, based on the best available evidence, at preventing you from spreading disease to other people. So no inconsistency there. It's just the recommendation changed because the information changed, and that's what you want from your public health leaders.
And the argument made that you knew about asymptomatic transmission at the time that you said that, and that you were essentially misleading the public so that they
the honest answer to you is no, we did not. That was the recommendation of the World Health Organization and the CDC, and we gave you the best information we could at the time. So I actually a little bit resent that implication, because I work hard to try to protect the American people, and we are always going to give the American people the best information we have available at the time. And we're humble enough to say, look, if we don't know, we're going to change. We're going to change those recommendations.
Just a wise guy question, that's all. Please, go ahead.
Mr. President, I wanted to ask you about the launch of the military satellite by Iran. Wanted to get your response to that. Do you see this as an advancement of the missile program?
You mean the shot they took? Well, they say no. Okay, they say all sorts. It was for television. Does anybody really believe that? They want to have better television in Iran. So they say no. We're watching Iran very closely, very closely. We know more about Iran than they do right now. We know more than they do. So we know all about it. We watched it. We knew it was going up. We followed it very closely. They say it was for television. Yes, please.
Mr. President, just a quick
Go
follow-up.
ahead, finish up then, please.
Yeah, very quickly. Are you concerned that they see this as a potential vulnerability on the part of the United States? There was the outbreak.
What is a vulnerability?
military readiness, the outbreak on the Roosevelt, the fact that you're consumed with dealing with coronavirus here in the United States.
Various navies have had outbreaks of COVID. Look, we're in 184 different nations right now. 184, the COVID. No, we have a problem on that. Just shows you how rapidly it spreads. It started off with 2 sailors and then 10 sailors and 20, and now I hear it's 540, of which one's died and a few are very sick, but most of them are back in great shape. But we did lose one, and it attacked the lungs of that young person. And then we also had a number that were quite sick, but they're all either better or getting better. But most of them are better for a long time already. Okay, please.
Thank you, Mr. President. As you know, over the course of the past few weeks, there have been the closures of several meat processing companies across the country in several states. Is this a concern to you? Are you going to increase testing in these facilities?
Look at South Dakota, how well the governor's. Look at South Dakota, how well the governor's done there, and all of a sudden you have a big spike in one location, and she's got that very much under control, as you know. But nevertheless, that was surprising, and they had a big one right near where you were yesterday, as I understand it, and. So we're concerned about that. They're closing 1 or 2 of the plants, actually.
Is the food supply secure?
Yes, totally secure. It's in great shape. In the back, here you go.
Thank you, Mr. President. The Attorney General in the state of Missouri filed a law case against China, accusing it of lying and covering up about the origin of the virus. Do you support that? And do you call
I haven't seen the case. I know about the case. He filed a case against China. I love Missouri, as you know. It's great. But I'm going to take a look at it. I actually know about it very much. I have to take a look at it. I have not seen the case in terms of reading it, but I will be doing that.
Call for international investigation.
Well, we're going to have to take a look. Oh, we're doing investigations. We're doing our own. But I do want to see and review that lawsuit. I'm sure that won't be the last one.
I just had a follow-up question for Dr. Fauci, if you don't mind.
Yes, sure.
I'm happy to ask you one after. John had asked the president about Rick Bright, and he said he wasn't sure who that was, but I'm sure you're familiar who he is since he was the head of BARDA. So there's a concern or an accusation he's raised that he was removed from his job because he protested widespread use of hydroxychloroquine. Are you familiar with this situation, and do you feel like public health experts feel they are able to speak publicly or to speak out in opposition to things? Yeah. So you don't feel like there's any concern among people at the NIH right now or in the public health community?
At the NIH? Absolutely not.
Dr. Fauci, knowing Dr. Bright and knowing what his gifts are as one of the country's leading experts on vaccines, are those gifts best suited at NIH rather than BARDA? What's he going to be doing with you?
What is he going to be doing at the NIH?
First of all, are his gifts best suited to work with you rather than BARDA?
I don't really think I can comment on somebody's relative gifts. I mean, he's going to be at the NIH and he's going to be responsible. From what I hear, again, this is what I've heard, that he's going to be responsible for the development of diagnostics, which is very, very important. The NIH is going to be involved in trying to develop new generation diagnostics, which we feel is going to be very important for the future of being able to facilitate the kinds of things that now are sometimes problematic.
And why do you say he has great gifts or gifts? What, do you know him? No, but have you reviewed him? Have you studied him? Have you reported on him? You said his gifts. I mean,
his entire career.
Well, that doesn't mean you have gifts. I know a lot of people, they play baseball, but they can't hit 150 in the major leagues.
The flu vaccine last year.
No, but you talk about his great gifts. Go ahead, please. Please, go ahead. You could go, please.
No, thank you, sir. I have 2 questions, one for myself and then one for a colleague of ours who cannot be here today because of social distancing.
From where?
I'm with the USA Today. First, the executive director of the National Association of Counties said today that the White House did not want to see money for local, state and local governments in the latest COVID assistance package.
And they didn't want to say what? What does that mean? Tell me.
I'm sorry?
What does it mean? Repeat it. Say it a little differently.
The executive director of the National Association of Counties said today that the White House objected to putting funding for state and local governments into the latest COVID assistance package.
Oh, really? That's interesting. Is he a Democrat?
I do not know,
Well,
sir.
check it. How could you ask that question
well,
without
but
knowing?
what-
Check it out. You'll find out.
I'll check it out.
Okay,
But
what's the
he-
next
he says-
question?
His question was.
You
his
know the
point-
numbers, you know the money we put into states, local governments, everything else, and they have to be responsible for their own finances. But you check it out. Go ahead. What's the
His
next?
point was that he said that you felt like that this would somehow be a disincentive for states to open their economies. Is he correct about that?
How would he know what I felt? I never spoke to him. I don't even know who he is. You don't know who he is either.
Yes, his name is Matthew Chase, sir.
Okay, it doesn't help me and it doesn't help you. Okay, go ahead, Jim.
Mr. President, also.
Do we want to keep going a little while
Yes,
longer or
yes.
no? You're not going to say, oh, he took questions all night long. Okay, right?
Yes,
Right?
please, thank you.
Okay, well, good. How many questions can you ask? Go ahead.
Also-
We all have fun because we're talking about something very important. The main thing is, I think we're getting to a lot of solutions. We never want this to happen again. We never want this to happen again, what happened. And if it should come back in some form, we want to snuff it out very quickly before anything can happen. And I personally hope it doesn't come back in the fall as a combination of the flu or not as a combination of the flu. But I think we learn a lot. And, you know, some of these questions are good. Some of them are ridiculous, frankly, but some of them are very, I think some of them are very important questions. Very important. You know, when you asked Dr. Fauci about the right to speak, if I let him speak, I'll let anybody speak. And we love him. Let's go.
Mr. President, Senator McConnell said today that he would prefer to see states that have high public pensions declare bankruptcy rather than taking on more.
I heard he said that.
federal bailout
I
money.
don't know what he said. I'll have to call him and ask him.
That's what he said.
Well, that's okay. I'm going to have to look at it directly.
Would you agree with him on that?
I can't tell you that. I have to see. I want to base it on fact and reason. I want to see what he said. You know, why he said it and how he said it. I'd have to watch him say it. But some of the states are not doing well. Let's face it, and some are doing phenomenally well. A state where Mike was governor, Indiana. I looked at their numbers. They have. It's incredible what they're doing. Some states are doing fantastically well. Iowa's doing great. You have states doing well, and you have some states that aren't doing well. We know the ones. I don't have to mention the ones that aren't doing well, but you do have states that are in trouble, and certainly they're coming back to talk to us. We'll see what happens.
Are you concerned, sir, about the growing U.S. national debt as a result of these stimulus
Well, we had no
packages?
choice. Do we have a choice? Yeah, I'm always concerned about everything. We had to fix this problem. We were attacked. This was an attack. This wasn't just, oh, gee. And this wasn't the flu, by the way. You know, they like to say the flu. Nobody's ever seen anything like this. 1917 was the last time. We were attacked. We had the greatest economy in the history of the world. We had the greatest economy, better than China, better than any place. They will tell you that. I dealt with them for a long time, and they will tell you we had the greatest economy, and we built it in the last 3 years, 3.5 years, we built it. And then one day they came and they said, you have to close it. I said, you got to be, these people right here, they said, you have to, they came into my office, into the Oval Office, and they said, we have to close the economy. I said, let's explain this. Explain this to me. The greatest ever in history, and we had to close it. Now we're going to open it again, and we're going to be just as strong or stronger. But you have to spend some money to get it back open. We saved our airlines. We just, as you know, finished up with the airlines. We saved numerous companies that are great companies that 2 months ago were having the best year they've ever had. Now all of a sudden they're totally shut out of markets. There was a great spirit today. You know, the fact is some of the governors are opening up their states. And I saw it. I feel it. I don't know if you folks feel it. I feel it. There was a great spirit today. I don't know. The stock market was up today, I guess. It was up quite a bit when I just walked out here. And I will say, I feel much different today than I did 2 or 3 days ago. And I think the world does. We spoke to a lot of leaders. The world feels that we're really leading a path of optimism. European Union's having a lot of difficulty. You know, you take a look at what's going on with the European Union. It's having tremendous difficulty. But we're going to be back, and we're going to be back stronger than ever. We're going to be at a level, I think, that everybody's going to be and they do. They look up to us. They want to know, what are we doing? What are we doing with therapeutics? What are we doing with vaccines? We're going to have those answers, too. We're going to have them. Just like we took care of ventilators, just like we're taking care of and already, as we said 100 times, we had more testing than any nation in the world. We had more testing than all of those nations put together that we mentioned the other day, all of them put together. And we're going to be, within 2 weeks, at a level that nobody's ever even seen before. They've never seen where we are right now. You don't have to build new machines. You don't have to build new labs. We already have them. But some of the labs are even upgrading to be able to double and triple their capacity in one case. Now, we're at a level that nobody's ever been. We're going to be bigger, better, and stronger than ever before. So I'm not concerned about that. Thank you very much.
Would you change your mind if Dr. Tedros was replaced?
Dr. Burks?
Can we just ask you about the first confirmed death being 3 weeks earlier than
All right, folks, thank you so much for joining us and choosing us as your stream of choice. If you're new to the channel, we encourage you to subscribe and click that notification bell. Once again, if you are new to the channel, we encourage you to subscribe and click that notification bell. We cover President Trump's press briefings daily, so make sure you guys don't miss it here at Golden State Times. Also, if you want to get notified for tomorrow's press briefing and you don't want to rely on YouTube, because YouTube does not send notifications, all you have to do is text the word Trump Live to the number 555-888. Once again, that word is Trump Live, as you can see it on the banner on your screen. Trump Live to the number 555-888. Last but not least, don't forget to follow us on Twitter at Gold State Times. On Twitter at Gold State Times. Once again, folks, if you are new to the channel, hold on. All right. So once again, if you are new to the channel, we encourage you to subscribe and click that notification bell. To get notified for tomorrow's press briefing live, all you have to do is text the word Trump Live to the number 555-888. 55-58-88. Thank you so much, folks. Everyone that shared the live stream. Everyone that supported us through Super Chat, through membership. Welcome if you're a new member today. And also everyone that shared the live stream on social media. Follow us on Twitter, folks. We put a very interesting video up on Twitter. If you guys have any questions, let me know. Let me know if you guys have any questions. Thank you so much to Gorf, Sayuri Blue 90, Olaf and Co., and we also have Carolyn Hall and Deacon and Truck and Gorf and Brian in the chat. Actually, I haven't seen Brian in a while. If anybody knows if Brian Knight is doing okay, tell him that Golden State Times said hello and that we miss him. Brian, I hope he's okay. Very awesome patriot. He's also a veteran. He's a veteran and he's a patriot. Former Marine.